Dr. Mills, and I'm a psychiatrist in California with my own private practice called Freedom Psychiatry because mental health is freedom. My practice focuses on achieving mental wellness using medications, nutrition, and lifestyle changes. I will be posting videos on a regular basis that answer common mental health questions. Today, we're talking about psychiatric medications and whether or not they cause a decrease in fertility.
Hi, Dr. Mills.
Hi.
I do have a question that came in. Do psychiatric medications cause infertility?
I'm glad you asked that. But the answer is a bit complicated because there are so many psychiatric medications. Some of them do cause a decrease in fertility, and some of them don't, and they don't affect it at all. But before we continue, I want to remind everyone that I am not promoting any specific psychiatric medication, nor am I compensated by the pharmaceutical companies to list medications in this video. Also, it's important to remember that each person is an individual, and the risks may be too high to switch medication from a medication that only causes a small decrease in fertility. Please work with your reproductive psychiatrist about your medication choices.
Here's a question, Dr. Mills. I suffer from depression. Can that make it harder to get pregnant?
That is a good question. The answer to this is two-part because it deals with the medications to treat depression and then depression itself. So, some antidepressants called SSRIs, two examples of those are sertraline and fluoxetine, can cause a decrease in fertility by causing problems such as difficulty with erection and or ejaculation, or even decrease in sex drive. However, depression itself can lead to sexual dysfunction. So it's really important to treat the depression because depression also causes other quality of life concerns. An option can be to continue the medication if the sexual side effects don't bother the person and just use assisted reproductive technology in order to help the person to become pregnant. Or the person can actually talk with their psychiatrist to either add on a medication or to switch to another medication to treat the depression that does not cause sexual side effects. Also, something to know about SSRIs is that research has shown that there's no difference between women who are taking SSRIs and those who are not taking SSRIs and their results with IVF.
That's good to know, Dr. Mills. Thank you very much. Here's another question. I have bipolar disorder. Are there medications I should avoid when trying to get pregnant?
So, there are a couple medications that are used to treat bipolar disorder and schizophrenia, and they can change your hormone levels. So, two of those medications are called risperidone and haloperidol. And what they can do is they can cause an increase in the level of the hormone that's called prolactin. Prolactin is the main hormone that women's bodies use to cause lactation. But once prolactin is elevated, it also can cause menstrual cycle irregularities, and that can make it very difficult to become pregnant. So, what I would do is talk with your psychiatrist about whether it's a good idea to switch the medication or to add a medication to try to assist with the difference in the prolactin levels. In addition to that, there are some other medications that are used to treat mental illnesses that can cause excessive weight gain. Any medication that causes excessive weight gain can lead to what's called PCOS. PCOS stands for polycystic ovarian syndrome, and it leads to a change in your hormones that can cause irregular periods and difficulties becoming pregnant. So it's really important to talk with your doctors to try to prevent the weight gain as much as possible, or if you've already got PCOS, to try to lose some of the weight. That can be done through nutrition changes, exercise, and even medical weight loss medications if that's necessary. Really, I just want to make sure that you're working with your reproductive psychiatrist in order to get the results that you want with your fertility and your mental health. If you would like me to be your reproductive psychiatrist, please go to my website, freedom-psychiatry.com, click on the book appointment button, and schedule your 15-minute free consultation with me, Dr. Mills. Thank you so much for listening. Have a great week. And remember, mental health is freedom.